Welcome back to MedMind. Today's quiz is about general pharmacological principles. Before we start, hit the like button and also subscribe the channel so that you don't miss any such quizzes in future. So, let's begin our quiz. Essential drugs are A. Life-saving drugs, B. Drugs that meet the priority healthcare needs of the population, C. Drugs that must be present in the emergency bag of a doctor, D. Drugs that are listed in the pharmacopoeia of a country. Correct answer is B. Drugs that meet the priority healthcare needs of the population. An orphan drug is A. A very cheap drug, B. A drug which has no therapeutic use, C. A drug needed for treatment or prevention of a rare disease, D. A drug which acts on orphanin receptors. Correct answer is C. A drug needed for treatment or prevention of a rare disease. Drug administered through the following route is most likely to be subjected to first-pass metabolism: A. Oral, B. Sublingual, C. Subcutaneous, D. Rectal. Correct answer is A. Oral. Transdermal drug delivery systems offer the following advantages except A. They produce high peak plasma concentration of the drug, B. They produce smooth and non-fluctuating plasma concentration of the drug, C. They minimize interindividual variations in the achieved plasma drug concentration, D. They avoid hepatic first-pass metabolism of the drug. Correct answer is A. They produce high peak plasma concentration of the drug. In addition to slow intravenous infusion, which of the following routes of administration allows for titration of the dose of a drug with the response? A. Sublingual, B. Transdermal, C. Inhalational, D. Nasal insufflation. Correct answer is C. Inhalational. Which of the following drugs is administered by intranasal spray/application for systemic action? A. Phenylephrine, B. Desmopressin, C. Azolastine, D. Beclomethasone dipropionate. Correct answer is B. Desmopressin. Compared to subcutaneous injection, the intramuscular injection of drugs, A. is more painful, B. produces faster response, C. is unsuitable for depot preparations, D. carries greater risk of anaphylactic reaction. Correct answer is B. produces faster response. Select the route of administration which carries the highest risk of adversely affecting vital functions: A. Intraarterial injection, B. Intrathecal injection, C. Intravenous injection, D. Intramuscular injection. Correct answer is C. Intravenous injection. Alkalinization of urine hastens the excretion of A. weakly basic drugs, B. weakly acidic drugs, C. strong electrolytes, D. nonpolar drugs. Correct answer is B. weakly acidic drugs. Majority of drugs cross biological membranes primarily by A. B. facilitated diffusion, C. active transport, D. pinocytosis. Correct answer is A. passive diffusion. Diffusion of drugs across cell membrane, A. is dependent upon metabolic activity of the cell, B. is competitively inhibited by chemically related drugs, C. is affected by extent of ionization of drug molecules, D. exhibits saturation kinetics. Correct answer is C. Is affected by extent of ionization of drug molecules. Which of the following drugs is most likely to be absorbed from the stomach? A. Morphine sulfate. B. Diclofenac sodium. C. Hyoscine hydrobromide. D. Quinine dihydrochloride. Correct answer is B. Diclofenac sodium. Which of the following is a weakly acidic drug? A. Atropine sulfate. B. Chloroquine phosphate. C. Ephedrine hydrochloride. D. Phenytoin sodium. Correct answer is D. Phenytoin sodium. The most important factor which governs diffusion of drugs across capillaries other than those in the brain is A. Blood flow through the capillary. B. Lipid solubility of the drug. C. pKa value of the drug. D. pH of the medium. Correct answer is A. Blood flow through the capillary. Active transport of a substance across biological membranes has the following characteristics except A. It is specific. B. It is pH dependent. C. It is saturable. D. It requires metabolic energy. Correct answer is B. It is pH dependent. Tricyclic antidepressants can alter the oral absorption of many drugs by A. Complexing with the other drug in the intestinal lumen. B. Altering gut motility. C. Altering gut flora. D. Damaging gut mucosa. Correct answer is B. Complexing with the other drug in the intestinal lumen. Bioavailability of drug refers to A. Percentage of administered dose that reaches systemic circulation in the unchanged form. B. Ratio of oral to parenteral dose. C. Ratio of orally administered drug to that excreted in the feces. D. Ratio of drug excreted unchanged in urine to that excreted as metabolites. Correct answer is A. Bioavailability differences among oral formulations of a drug are most likely to occur if the drug A. is freely water-soluble, B. is completely absorbed, C. is incompletely absorbed, D. undergoes little first-pass metabolism. Correct answer is C. is incompletely absorbed. The most important factor governing absorption of a drug from intact skin is A. molecular weight of the drug, B. site of application, C. lipid solubility of the drug, D. nature of the base used in the formulation. Correct answer is C. lipid solubility of the drug. If the total amount of a drug present in the body at a given moment is 2.0 g and its plasma concentration is 25 g/ml, its volume of distribution is A. 100 L, B. 80 L, C. 60 L, D. 50 L. Correct answer is B. The following attribute of a drug tends to reduce its volume of distribution: A. high lipid solubility, B. low ionization at physiological pH values, C. high plasma protein binding, D. high tissue binding. Correct answer is C. high plasma protein binding. Marked redistribution is a feature of A. highly lipid-soluble drugs, B. poorly lipid-soluble drugs, C. depot preparations, D. highly plasma protein-bound drugs. Correct answer is A. Highly lipid-soluble drugs. A non-volatile, highly lipid-soluble drug is metabolized at a rate of 15% per hour. On intravenous injection, it produces general anesthesia for 10 minutes. Which process is responsible for termination of its action? A. Metabolism in liver. B. Plasma protein binding. C. Excretion by kidney. D. Redistribution. Correct answer is D. Redistribution. The blood-brain barrier, which restricts entry of many drugs into the brain, is constituted by A. P-glycoprotein efflux carriers in brain capillary cells. B. Tight junctions between endothelial cells of brain capillaries. C. Enzymes present in brain capillary walls. D. All of the above. Correct answer is D. Which of the following is not true of the blood-brain barrier? A. It is constituted by tight junctions between the endothelial cells of brain capillaries and the glial tissue. B. It allows passage of lipid-soluble drugs into the brain. C. It limits entry of highly ionized drugs into the brain. D. Correct answer is D. It regulates passage of substances from brain into blood. Weakly acidic drugs, A. Are bound primarily to alpha-1 acid glycoprotein in plasma. B. C. Are highly ionized in the gastric juice. D. Do not cross the blood-brain barrier. Correct answer is B. Are excreted faster in alkaline urine. High plasma protein binding, A. Increases volume of distribution of the drug. B. Facilitates glomerular filtration of the drug. C. Minimizes drug interactions. D. Correct answer is D. Generally makes the drug long-acting. The plasma protein-bound fraction of a drug, A. Contributes to the response at the given moment. B. Remains constant irrespective of the total drug concentration. C. Remains constant irrespective of the disease state. D. Correct answer is D. Biotransformation of drugs is primarily directed to A. Activate the drug. B. Inactivate the drug. C. Convert lipid-soluble drugs into non-lipid-soluble metabolites. D. Convert non-lipid-soluble drugs into lipid-soluble metabolites. Correct answer is C. Which of the following is a prodrug? A. Hydralazine. B. Clonidine. C. Captopril. D. Correct answer is D. Enalapril. Comment down your doubts if you have any, and also don't forget to comment your final scores. So, that's all from this quiz, but you can continue learning by watching our next video.